Hi everyone, this is Shalu Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. Welcome back to my YouTube channel. I am back with another NMC OSCE video for you. So hopefully you do like the channel and please keep watching, share it with your friends or other nurses who are preparing for OSCE or generally are nurses from abroad and want to obviously enhance their skills according to NMC OSCE marking criteria. Okay, so let's get started. Today's topic is very interesting one. It's one of your professional values which I think it might be mentioned in one of the videos, but it hasn't been covered fully. So it is the drug error. Okay, so we are going to look at what is the professional duty regarding drug error in UK, what you have to do as a professional nurse if you realize that you have made a drug error. So that's why it's part of your syllabus in professional values. So what does the code tells us? What should we do as a professional if we made a drug error? Okay. So that's what we're going to look at today. So it's your one of your professional values topic, and it will have a scenario. It's a 10-minute station. It's a written station. You will have a scenario, and then you will have to write your answers as bullet points, mentioning your actions you will take if you realize you have made a drug error. Okay, so if we look at the scenarios could be very simple. Like here, you are completing your nursing medication round and you notice that so you're completing that and you recognize that your patient is due for hypertensives. You go ahead and you dispense those hypertensives and you give it to the patient as they're written in the medication chart. But then you just realize that you come on the morning shift, but the night nurse handed over that the patient had once only dose of the antihypertensive because their blood pressure was quite high last night. But that kind of slipped out of your mind and you didn't check for the stat dose given, and you went ahead and gave them the regular dose again this morning. So the patient had more than needed antihypertensive in that time period of 24 hours, if you want to say that. So you realize that you have made a drug error. You should have waited good few hours yet when their next dose would have been due because they had once only dose, additional dose at night. So obviously the mistake has happened. So what are the actions you need to take now to keep your patient safe? So what will be your actions in this case? And you have to write your answers as bullet points. So that's what the topic is. Okay, so first thing is on the next screen, we're going to think about what are the points which are coming to your mind. Okay, so these are the points which are coming to our mind when a drug error has happened, and then we're going to go and write our answers, okay, as needed in the exam. So first thing to think is to recognize that the drug error can cause harm to your patient, okay, serious harm. Okay, so that's the first thing to recognize that. The action, so you need to take actions to reduce that harm immediately, okay, without delay. You need to be taking actions to obviously reduce the harm to your patient, and the first thing you do is obviously check your patient's vitals very, very quickly, straight away. Do whole set of vitals, and then next thing would be the seek urgent help really from your nurse in charge and the patient responsible for that doctor responsible for that patient care, because you cannot deal with some drug errors yourself. You have to get urgent help, senior help. Next thing is duty of candor. So that means it tells us that open and honest with our patient. So we do need to tell the patient that the drug error has happened. Documenting in patient notes about the error and any harm already occurred to patient or what actions you have taken to reduce the harm is really important that you document in patient notes. Remember, if it's not documented, it's not done. So you really need to document. And also there is every healthcare provider have to have a incident reporting system. So you need to complete an incident form because it is an incident which can harm your patient. Okay, and then the very important one, next one, is reflecting why that drug error happened. You need to really think hard to think what is it that made you? What things have gone wrong? Why did you ended up making that drug error? Okay, is it something lacking the way you do your drug round, or maybe need more training, and maybe there were other factors, you got disturbed, or whatever it was. You really need to think hard why that drug error happened from you, and how you will, what things you will do and learn differently, so it does not happen in future. Okay, so learning from mistake is really, really important. So that's all. And then obviously upholding the value set in the code will write that point. So let's go ahead and write our answers now we have discussed what we need to do. Okay, so first thing is recognizing the problem. I recognize that drug error can cause harm to my patient, and it is important that I take appropriate measures without delay to maintain my patient safety. So that's really, really, really important one, and reduce the effect of any possible harm. Okay. Next thing, I will check Mr. Roberts' vital signs straight away, and then find out his clinical stability, and inform the drug error event to nurse in charge and medical team to seek immediate help. Okay, so you really need help and advice urgently. Next one, I will discuss the drug error with my patient to adhere to the duty of candor. So that's really, really important, because we have to be open and honest with our patient. Next one, I will document drug error, including my actions and any consequences, means anything which has already harmed the patient, anything consequences of that drug error for my patient in my patient notes, and complete an incident form. Next one, I fully understand the need to reflect and explore the reasons and look into the sequences of events leading to drug error. Okay, why did it happen? I will identify my learning needs and revisit the drug administration protocol. So last one is, I understand that I need to keep and uphold the values of the NMC code, which are prioritizing people, practice effectively, preserve safety. Of course, drug error is really big safety thing, so preserve safety and promote professionalism and trust. People trust us, patients trust us to give them, that we are going to give them medication in the safe way. So all of these values are in that, relate to this topic, so make sure you mention that as well. Okay, so that's how we write the answers for these topics. I hope this is now clear in your mind, that if drug error happens, and that this is not only for just the exam, it's really, that's what we do if a drug error happens. Okay, so we really need to follow these safety things for our patient if a drug error happens, because drug errors can really harm our patients. They're serious. Okay, so I hope now this topic is clearer to you, and you will not make any mistakes in writing these answers. So hopefully you like this video. If you like the video, please press the like button now and subscribe to my channel. You can also visit us on OSCEnursetraining.com or email us at oscenursetraining@outlook.com. I will soon be back with another video for you. So bye for now.